In this video, we will talk to you through your pain relief options for labour, starting from non-medication based pain relief. For this, you can consider breathing techniques, movement, massage, pressure points, water immersion, heat, and TENS machine. TENS machine will work by distracting your body signals from the contracting uterus to touch signals in other areas. So then we'll move on to medication-based pain relief. You can have paracetamol or Panadol, the normal adult dosage, safely in pregnancy. This is also good for early labour at home. Once you get to the hospital, we can give you something a bit stronger, which is cocodamol. This is a mixture of codeine and paracetamol. The next level up from there is Entonox. You might have heard of this. It's sometimes known as gas and air or laughing gas. This is a transient medication of nitrous oxide and oxygen. It's a blend that aims to just take the edge off the contractions. It also helps you to take focus on breathing and deep breath throughout your contractions. In between, we will encourage you always to breathe normal air also. This is often paired with other methods such as water immersion.
If you are in the early stages of labour, you may also be offered an injectable morphine, which is a strong opioid pain relief. This can be helpful if your labour is long and you need some rest. It can also help you to relax. It lasts between 2 to 4 hours usually. We use this medication carefully as this does cross the placenta, and therefore baby will feel the effects of this too. So we don't want to give this too close to the birth, as sometimes babies may need some assistance when they are born.
We have an experienced team of anaesthetists here at King's. We might be a part of your birth journey if you decide to have an epidural in labour or if you have a C-section. I'm going to discuss some of the frequently asked questions about the epidural. At what point during the labour can I receive an epidural? A woman can receive an epidural at almost any time in labour if she can remain relatively still. However, an epidural is generally not given if the baby is very close to being delivered. Some women have heard that they need to be dilated a certain amount before an epidural can be given. However, according to the recent guidelines, just a simple request from the mother is sufficient. There isn't a minimum cervical dilatation. I have done epidurals at 1 centimeter and even up to a point where the woman is near fully dilated as well. Does the epidural hurt? Before the epidural is administered, you will receive a numbing injection, much like you would at the dentist before a cavity filling. That initial injection in the lower back can sting for a few seconds, but after that, one should feel no pain, just the pressure of the epidural needle being inserted. When will I feel the pain relief from epidural? Epidural takes about 10 to 15 minutes to be administered. The pain relief from the epidural should begin about 15 minutes after it has been initiated. As long as the mother is in labour, epidural medications will be administered as a continuous infusion, and it will be only discontinued once the baby is delivered. Can I move around after I receive an epidural? Usually, women have to stay in bed after an epidural has been administered because the decreased sensations in the leg will put her at a higher risk of falling. Are epidurals safe? Epidurals are extremely safe, but much with like any other medical procedure, there is a very small risk of complications. Very minor side effects like low blood pressure, itchy skin, headaches are very easily managed medically. Serious risks like blood clots in the spine, infection or nerve damage are fortunately very rare. Do epidurals cause nerve damage? The risk of nerve damage from epidural is very rare, less than 1% of the cases. This could occur if the needle is inserted in the wrong location, or if it advances too far, or comes in contact with a nerve root. If the nerve damage does occur, it is usually very temporary and resolves typically within a matter of few weeks. Does the epidural affect the baby? The advantage of epidural as a pain relief technique is that very little amount of the medication that has been administered actually reaches the mother's blood. Most of it just circulates in the epidural space, and the direct effect of it on the baby is negligible. If you have a C-section that is planned, you would have a spinal injection, which is a one-off that lasts during the duration of surgery. And if you were in labor and you already had an epidural, and if it has been working very well, the anaesthetist can sometimes just top it up and use it as an anesthetic technique for your C-section as well.